Hello, I'm Dr. McKenney, and we will be with you shortly to explain in detail the results of your examination. But before that, I want to share with you some principles about your body that will help in the healing process. You're probably here because of pain, but pain itself is not your problem, but rather the result of a problem. Pain can be compared to an engine warning light. For example, a warning light may tell the driver that the engine is hot or the oil is low, but the light is not the actual problem, just as pain is not. That's why pain medication doesn't fix a problem, but rather masks the problem by turning off your body's natural warning system. It is important to understand that in a chronic case where there has been no trauma, pain is usually the last thing to appear and not the first. Like an engine warning light, your body doesn't show symptoms until the real problem gets bad enough, and unfortunately, in some cases, this process has been going on for a very long time. This is true for heart disease, cancer, and every other major ailment, including spinal nerve problems. While pain is usually the last thing to appear, it is the first to go away. That's why our goal in this office is not to merely get rid of the pain, but actually correct the underlying problems to the best of your body's ability. We don't want to patch up the problem only to find it comes back worse the next time. If all you're looking for is short-term, temporary relief, then painkillers might be a quicker and, in the short run, a cheaper way than correcting it. However, masking a problem not only doesn't correct the problem, but puts you at serious risk of making it worse. So if you're accepted for care, please follow through with recommendations, and like hundreds before you, you will be glad you did. Making a change in the human body requires two things: time and effort. This is where the doctor-patient relationship really comes into play. It's called team effort. Things like following instructions and keeping appointments will be vital to our outcome. In a moment, we'll talk about the subluxation, sub meaning partial and luxation meaning out of place. It's actually the name for the condition often referred to as a pinched nerve. A subluxation alters nerve impulse. A conceptual analogy would be turning a rheostat to dim a light bulb. When nerve flow is interrupted because of a subluxated vertebra, one can suffer from musculoskeletal problems like back pain, migraines, numbness, and tingling, as well as problems with the internal organs. Nerves control everything in our body. The subluxation can also cause premature wear and tear to a disc, referred to as degeneration or arthritis. The weakening of a disc is a precursor to a disc herniation in the future. The only way a subluxation can be corrected is by the chiropractic adjustment, a process by which a chiropractor gently moves the bone with their hands, with each adjustment moving the bone only slightly back towards its normal position. You need to understand that chiropractic care is the safest form of health care there is. Our staff and our doctors are highly trained at what we do, so please relax. It is important for you to know that we only accept patients that we feel can truly benefit from our care. And if you're accepted for care, rest assured that you will never be asked to make visits to our office that aren't necessary, accept care that isn't necessary, or spend money that isn't necessary, as we are as concerned with the cost of health care as you are. However, your most important contribution to our relationship will be your commitment to getting well, and not just out of pain. That will require you to follow our recommendations for care. We look forward to partnering with you and taking care of this wonderful and miraculous gift we call the human body. Thank you. We will be with you shortly.